Hey, Holt, can you share the link with Dr. Raker and Brian really quick?
Yep.
Okay, they're going to share it with you right now.
Great.
Okay, perfect. Okay, thanks.
Welcome, Dr. Woods
Okay,
and
no, sounds
Jeff.
good. Thanks. Bye.
We'll get started here in just a minute. Just need to get a couple more experts online for you.
I sent it over to Brian, so
Did you send it to Raker?
I'll email it to him right now.
Yeah, so Dr. Fred Woods is one of the people that's registering for the seminar that I have lined up. He's also interested in equipment. And then I'm pretty sure the other guy, David, said unverified, was one of my other people, but he looks like he dropped off. So I just texted him that we're
Yeah,
starting.
we're live, Eric. So
Oh, okay. Right, there he is.
Dr. Raker, we see you've joined. We don't see your video yet, and it looks like you're on mute.
There.
There you are.
Now you can hear me, right?
Yes.
These different programs, I'm looking different places for different buttons, but I'm figuring it out.
I know. It's funny how that works.
Yeah. Zoom was pretty easy, but Teams is getting a little, I got to figure it out. Trying to figure out why my picture looks smaller than you guys on my screen. It might be the same on yours.
It is. There's
Okay.
different view modes.
Okay. All right. Well, I don't need to see myself. I just need to see you guys. So. Hey, Dano, after this gets over, I want to talk to you about two projects that I'm working on that I need your help on. I got a hospital, a little rural small hospital. It went bankrupt and quit for like 5 years, and they passed a tax referendum. They rebuilt the hospital. It's brand new, and then now they're out of money. Because they're stupid. They keep doing stupid shit, right? Little hospitals are stupid. So, anyways, I want to start an OccMed program in this hospital to make them some cash money. And I'm going to round up, I think I can get like a spirometer from my spirometer people. I think I can get a Drager. I think I can get a couple things. And maybe I'm going to talk to you about maybe donating a piece of JTECH that they can start. Now, they might already have some as a hospital. They may have some equipment that the PTs are using. I don't know yet, but I'm going to get with you. And then the other one is University of Bridgeport. They wanted to do this like 5 years ago, and they got bought out by somebody, and it kind of got like pushed to the side. Well, Dr. Lehman just got back with me and said, hey, they just came to me and said, hey, what about this occupational program? So he reached back out to me, and if we get a system, we get this started in one college, every college is going to do it, and every doctor is going to be exposed to it going through college and want to do it when they get out of school.
Sounds fantastic.
So I'm gonna probably be calling on you for a little help with those two projects when I get a little more off the ground with them.
Great, great, fantastic. And
It would be
what we're
excellent place. It'd be excellent placement for JTECH to be in front of people. This hospital, if I get this one hospital doing this, there's 13 little rural hospitals in Arkansas that are all they work as a team to buy and do things. So if I get one of them making money doing something, all the rest of them will want to know how you doing it.
absolutely. And it's really straightforward. So
Yep.
good, good. Yes, we will talk. In fact, even when we're down there in a few weeks, in about 3 weeks, I guess, we can actually go visit them.
When you're down where?
By you.
You're coming to me?
Well, yeah, for the seminar
Oh, in Dallas.
in Dallas. These are over in your city?
Close to Arkansas, and close to my town. So they're going to be about 4 hours from Dallas because I'm 3 hours
okay.
from Dallas.
Okay. Didn't know where they were.
Yeah.
Well, good. Well, we have Dr. Woods on, we have Vine Therapy on, and we have Jeff on. So we can probably kick off. We had interesting, of course, this is normal. We had at least 10 others registered to join us, and one joined and dropped off. So maybe he saw my face and that scared him or something. But anyway,
probably got called by a patient. I got Anthony Silver from California to sign up for the Dallas meeting, so he's coming.
Oh, fantastic, fantastic. Well, good. So we can probably go ahead and get started.
Let's do it.
Yeah. So as soon as you're finished eating your lunch,
that's my peanuts. All right, I'm done.
Fantastic. Well, we have Erik Groberg here, and he will be one of our instructors at the seminar. Of course, we have Dr. Raker here with years and years and years experience doing this, and he'll be one of our instructors. We are looking. I'll be an instructor as well. I'll be teaching the marketing side. Once you know how to do all of this, how do you get your customers? And I'm really looking forward to it. I've been just really excited about some of the new content that I found around this, as well as a lot of things I've learned about this industry. So I'm excited to share that. So with that, why don't we have Dr. Raker spend a minute and kind of give an outline of what he's going to cover, and then Erik can give an outline of what he's covering, and then I can talk briefly, and then we'll just start asking some questions and having a conversation. Sound like a good plan?
Sounds good, Dano. So I am excited to be here today, and we'll be super excited when we're actually in Dallas. So some of the doctors that are from my group have heard some of what I'm going to say. Some of the newer doctors have not. This is all about, what can we do as chiropractic physicians to expand our scope, or not really expand our scope, but expand the services we do away from traditional fee-for-service like insurance, paying for, therapy and x-rays and an adjustment. What's other things that chiropractors can do? Utilizing JTECH equipment, there is a lot of things we can do. So we're going to discuss things that go into the PI world. We're going to discuss things that go into the work comp world. We're going to discuss things that go into the occupational medicine world, which is, my big forte. I'm going to talk a little bit about the laws, the rules, how this comes into play, why this is needed, who the players in the system are, the ins and outs of laws and rules. And then I'll go through some, we're going to be working hands-on with the equipment with Erik, showing us how to do a lot of things. But we'll be going through some real life scenarios of how you walk into a business, what they need, what they expect, what you can talk to them about, what you can now show them that you have the capability of doing, and the knowledge of knowing how to do some of this stuff. And hopefully my few hours is going to open up some doors and some ways to go out and get into the industrial side of the occupational world to put your face forward and learn you how to do some of these services. So that's what my hours, what have I got? About 3 hours, Erik? Oh, turn your mic on.
Sorry. Yeah, you've got more than that. I think that you'll end up probably having, a good 4 or 5 hours, and then
Okay.
my part will be a little bit talking about some of the different services, but then, really going to focus on that hands-on training.
All right. Okay. Well, it doesn't matter. I can talk for 5 hours. I've got 24 hours of information to unload. So I've got lots of stuff we can talk about, but I'll have you there too, helping me demonstrate and show these docs how to utilize this equipment. So you can kind of give them a little rundown on what you're actually going to do then.
Okay, yeah, thanks, Dr. Raker. So again, my name's Erik Groberg. I'm the clinical director for JTECH. I've been with the company about 12 years, and that's really my specialty or focus in graduate school is more ergonomics, occupational injury prevention. And I was part of a PhD program that was funded and supported by NIOSH for, again, at one of they've got a handful of these dedicated education research centers. So it's kind of my background. When it comes to the different services that you can offer directly to employers, there's a lot of different services, job site analysis, pre-employment post-offer testing, fit for duties, where annually things like police officers, firefighters have to be annually tested for fit for duty. There's also other ancillary services, as Dr. Raker mentioned. Our systems are used and extremely effective in the personal injury, auto accident markets. You can do this for return to work exams, for work comp exams. It'll generate, if you want it to, our evaluation system will generate automatically a whole person impairment rating based on the AMA guide. So yeah, we're going to be getting into some of those things, and then yeah, the majority of the time left for day one will be really focusing on hands-on training. So we'll be taking a job site analysis that's already been done. And based on that job site analysis, that's really where it starts, is having an accurate job site analysis to accurately be able to quantify and document the actual physical demands, the essential functions, the physical demands of a job. So that's where it all starts, with having an accurate job site assessment, job site analysis. Usually the reimbursement on those is going to be anywhere from $1,500 to $2,500 for doing one of those job site analyses. And then that allows, on the post offer end, with new hires, them to be able to accurately test to those specific physical demands associated with the job, and make sure, A, that they're able to meet the physical demands associated with their job, so the employer is basically not hiring their next work comp claim. But also beyond that, being able to have baseline measurements of functional data at the point of hire. So for example, a new hire, the pre-employment post-offer exam is conducted on them. They're able to meet all the job requirements as far as physical demands, but they still have, let's say, a 30% reduction in range of motion in their left shoulder, 30% reduction in strength in the left shoulder. Well, down the line, let's say that employee is now involved in a work-related accident or injury, and now those range of motion or strength deficits are 60%. What that allows the employer to do, because they have those baseline values and metrics at the point of hire, it allows the employer to do something called apportionment. So instead of them being on the hook for the entire 60% deficits, also as far as getting them back to rehab, instead of going back to like zero baseline, they're only responsible for that 30% those additional deficits from the point of hire, which that's a huge savings to those employers. And then yeah, we'll then take that job site analysis, we'll break up into small groups, and those small groups will be tasked with creating a exam protocol that is going to test for those specific physical demands of those jobs. And then we'll come together round table session, and each group will kind of present their results, and we'll get to see, different approaches, because there's not like a cookie cutter approach to these kind of exams. And so Yeah, I've got some, like I've got a post-offer exam report pulled up if you want me to go through that real quick. I've got a job site analysis report pulled up. If you want me to go through any of that.
Yeah, we can take a look at those in just a minute. I wanted them to get a kind of a scope of everything that's going to be covered. And so the next topic, and so Eric will pull those up after this, but the next topic will be Saturday morning, which I'm excited about. I know all of you love working on Saturday, but we'll have some fun. But before I go there, I want to mention that in the top left of your screen, there's a little icon that says chat, and you can click on that to enter any questions you have as we're going through the conversation today. So I see, so I just put something in there, so it should show up that there's some chat. You can click on it. The chat will show up on the right side of your screen there. What we're going to talk about, oh, it's bottom left for Dr. Woods. Okay. I guess it depends on how you have your teams configured. So thank you for that, Dr. Woods. The Saturday morning, what we're going to do is by then you'll know what you're doing, what you have to offer, how to perform all of the different tests and the like. Literally, you'll walk out as experts ready to go, ready to launch this new arm of your business. And so then the next step is, well, who do I talk to? And so we're going to talk about who is the target market. And then within the target market, we're going to help you understand how to find the decision makers. And then we're going to work on your 30-second commercial or elevator pitch. And this is a lot of fun. This is real time. You'll walk out of it with your 30-second commercial. You'll be comfortable with it and be able to, anytime anyone says OccMed, and then you'll be able to just give them your 30-second commercial. Also, we'll talk a little bit about how to seal the deal. In other words, you find them, you're talking to them, give the 30-second commercial, provide some more details, and then you need to close the deal, and we'll help you with that. And then, of course, in all of this, as always, we have to stay organized. And so we'll talk a little bit about how to stay organized in your prospecting and looking for new customers, which, by the way, it sounds difficult. It's not. It's not. It's really straightforward. And then we'll talk about how do you get the word out, right? Just generally. We'll talk about specifically who to call, but then also you'll want to make sure, for example, that you have a social media strategy, that you have a direct email strategy, that your SEO is set up on your website, and of course, word of mouth, or as I like to call it, getting referrals. And so we'll talk about all of that in the marketing section. And it seems like a lot to cover, but it turns out it's not that difficult. And I'm going to hand you templates and information ready to go that you can just execute on. So you'll walk out with actionable things that you don't have to go create. We'll actually create them customized for you during the session, and then you can just go execute and find your first customer. So with that, anything else, Dr. Raker, we should mention before we kind of move into more of a Q&A, let Erik show a few things?
Not that I can think of. I'm excited to, if we can get some good questions rolling is really where I can get rolling and do some answers. So we'll let Erik kind of throw and go through his thing, and then we get into some Q&A, and I'll be excited to answer questions.
Great.
Okay, excellent. I'm going to share my screen, and this first screen is going to be of our North Star software. Are you all seeing that?
Not yet. Now I think it's going to start, maybe. My screen changed like it was going to share, but I still don't see it, Erik.
About now.
Not yet. This is the technical faux pas that I have.
Yeah,
There it
I'm
is.
trying
There it is.
okay,
There it is.
okay, it did show up. I just didn't wait long enough. All right, so this is our North Star evaluation system, that software platform and interface. So I've already loaded a patient file in here as well as an exam. Again, this will be for a pre-employment post-offer exam. And then one of the things with our North Star evaluation systems, you can go in and you can build and save into the software permanently any number of saved standardized protocols. So let's see here. So this one would be for based off, it's for a nurse. And so you can, the good thing about that is one of the things with like pre-employment post-offer exams, all of those exams for a specific employer for a specific job have to be completely standardized, not just the exact order of the test, but even the order you're testing them in. So this helps you with those standardized protocols, make sure you're ADA compliant and everybody is tested in the, not just the same battery of tests, but also in that standardized format. And so our software, as you're done with whatever test you're on, it will automatically then just um, go to the very next test that's listed in your protocol. So you don't even have to pay attention. This would be like if I'm doing like cervical flexion extension for range of motion. It'll go forward. And then as soon as I meet that AMA validity criteria, that 3 consecutive reps, the software is just going to automatically then kick me the next test in sequence. Looks like I didn't meet it on that one. So if you don't meet it in the first 3 reps, the software will just automatically prompt you to keep capturing data until you meet it. And then again, it just kicks you through the next sequence. So that protocol there looks like it would probably take you a while to get through. You'd be surprised how quickly you'll be able to get through these protocols. And again, it doesn't have to be a licensed healthcare professional performing those pre-employment post-offer exams. A lot of times what we'll do is we'll train up one of the staff members to do those exams. Then this, are you seeing the report I just pulled up?
We are.
Yes.
Okay. So this would be like a report that corresponds with that same protocol for registered nurse. It gives you a summary up front, our system does. Anything that's a job requirement is going to be contained in this summary. So floor lift, what's the job requirement? It's 50 pounds. What was the assessment? What they were able to do, is it a match? Yes and yes. That's what they're mainly looking for as far as employers, just right up front is here's the physical demands with that job. Were they able to meet them? If there were certain ones that then maybe they couldn't meet, then the employer can put them into like a work hardening or work conditioning program, which that's another service that you can offer. And then you get into more of the details if they want to look at them, of course, but mostly they're looking just right up front for those results of whether they can or can't meet the physical demands of the job. And then beyond that, usually with the pre-employment post-offer exam, it's not just those functional tasks. It's going to be some objective data like range of motion, muscle testing strength, grip strength, and then static strength is one of the big important ones as far as that objective testing. So again, the results will show you the AMA normal values, the test results, and then any of those deficits, again, at the point of hire based on the AMA norms, are going to show up in red. Same thing with muscle testing. You're able to document those left to right bilateral strength deficits at the point of hire. So again, if there's an injury and now it's a 50% deficit, well, now you have it documented that at the point of hire, they already have a 29% deficit. And if this were like, say, like a med legal, like an auto accident report, say it was a follow-up or a discharge exam, it would automatically, our software would automatically generate more of a progress report. Grip strength, yeah, a couple different tests there that are kind of standard with the post offer. And then, declaration statement, signature, and then all of our strength devices, they calibrate on a daily basis. So just making sure that you have included in there those daily calibrations before you do the exam. to show the accuracy of those devices. So then with here, and here's a interesting, this is a case study from a JTECH customer that implemented post-offer testing with a group. And again, the whole thing, and we'll get into this in the seminar, is about reducing their mod rates, their work comp mod rates, basically how much they're having to pay in work comp insurance premiums every month or every year. So they were able to reduce company up to 500 grand. For every dollar spent invested into doing post-offer testing, it saved the company $14. And then with the 175 pre-post test groups, a 41% reduction in injury costs. So that's pretty significant. And this is how you can initially stop the bleeding, get your foot in the door with employers. This is the quickest way to immediately stop that bleeding. And most companies, most employers are going to have like maybe 2 or 3 jobs that are kind of like their nightmare jobs. And so we'll get into some of those marketing tactics. But again, you can see that mod rate going from almost reducing in half, 1.94 to 1.0. Cost reduction in that 3-year period for the employers. Beforehand, the 3 years before doing post-offer testing, were just under 900,000. And then in the 3 following years after they implemented post-offer testing, those have reduced to 113,000. So literally almost an $800,000 savings. That's just the direct cost to the employers. And then again, we're going to be going over the job site analysis, why that's so important in order to do an accurate post-offer exam that is going to really test to what those physical demands are. We have a separate software program. It's called our Job Site 2 software. I've seen a lot of different job site analysis software. It's the best one I've seen. But this is an example of a job site analysis report, again, created with our job site software. People's Gas, Senior Service Specialist. This is one of those, an actual job site analyses that one of our customers performed. And I think he did 8 or 10 of them for this group. And I think he was getting paid, said just under $2,500 per job site analysis. So you've got your job task, job description. This is really the important thing of what you're going to be testing to. 50 pounds lifting, 100-pound 2-person lift. So those are the main ones that you're going to then on the post offer really focus on testing to. Most of the work-related accident injuries are going to be related to, low back lifting injuries, upper extremity musculoskeletal injuries as well. So then you can go on site and you can measure all of this. Is it essential function, critical demand, have all that documented. So then when it comes time to then perform a pre-employment post-offer exam, all of those physical demands are already described in detail, and you know exactly in your clinic what those physical demands are you need to test to. So yeah, we'll be going through that as well as a seminar as far as just taking a job and how to perform just some of the really critical elements, the most important elements in performing a job site analysis.
I tell you, this equipment prints the coolest reports. You've got graphs, you've got data, you got numbers, colorized and very easy to understand. So when you're sitting and going through it with a customer, it's not really hard to get them to understand what they're looking at. It's great.
Yeah, and our software, actually, we have a special software module that has the full DOT physical examination in it. So you can use our software for running them through those DOT physicals. And then at the end, it'll print off that FedMed report. So this is an example of a DOT physical that was performed in our software. I did it on myself, I guess. And it just goes through.
Did you fail or pass, Erik?
I think I passed. Although I'm not out on the streets driving a big rig, so maybe not. But yeah, that's also part of our software. So yeah, we'll kind of get into the different things that you can use with our systems. But beyond that, I mean, whether you have a JTECH system or not, this is going to be valuable. Our system will be able to provide a lot of the services that you can offer to employers. But beyond that, Dr. Raker is going to talk about a lot of the other services like drug and alcohol testing, respirator testing, hearing testing, those kind of things that aren't really necessarily tied with our equipment. So
I guess if somebody's asking a Q&A question, I guess in a minute we'll kind of go down through and kind of talk about those, correct?
Yes. And we can take them real time as they come in.
Well, and instead of me type an answer, I figured it'd be very faster and more efficient if I had, if I could say the answer. So,
Yes.
do you want me to take, so the first one here is how hard is it to do some of these certifications for like hearing and drug testing? So there are 5 certifications that you have to do. The other things are learned, but not certifications. But the 5 certifications are, you have to be certified to do DOT physicals, DOT drug test, DOT alcohol test, hearing testing, and pulmonary function testing. Those are certifications. Now, staff can get certified in everything but the exam. So 4 things staff can do. Only licensed healthcare provider can do the actual exam. Although the staff is going to help with part of the exam to make that go fast and easy. Now, the doctor to get certified on DOT physicals, it's somewhere between, they've changed it a little bit. It was 12-hour class when I took it. Now it's down to about 8 hours. So it's an 8-hour class. You can usually do it by web, and they give you a study guide and quiz questions to pass the course. And then you take a federal computerized test somewhere around you at a testing center. It's a 2-hour, they give you 2 hours. I just did my 10-year one earlier this year, and I got done in about 1 hour and 20 minutes. So I'm a little more familiar with the material. First-time doctors usually will take right at 2 hours to go through the test. That's probably the hardest thing. Everything else is easy. Drug testing certification takes 2 hours. Hearing alcohol certification takes about 4 hours. Hearing testing is used to be 2.5 days. Now it's a 1-day, 8-hour webinar that you can do, via like a Zoom meeting like this. And then pulmonary function testing is still around 2 days. And as far as I know, there may be half of it web-based, but you have to go in person to complete that course. So they offer it all over the country at different towns and different times. You can usually pick that up pretty easily within, 2 or 3 months, somewhere it's going to be close to you. Everything else I've taught, and just like respiratory mask fit testing, once I show you how to do it, you are now capable of doing it. So it's not that hard, very quick to learn and very easy. All right, was there any questions up there for Dano, you or Erik to go over?
What I find fascinating, Dr. Raker, is while you're out marketing and finding your first customers, you can actually be going through the certifications. You can do it in parallel, and just because your staff can do so much of it. And so from an ROI, you can get all the tools and systems you need. You can be getting your certifications while you're going and finding your customer base. And your first customer, I mean, of course, some of the things you do, they'll be, pretty low dollar value. However, you find a big customer and they can be extremely high value. So your ROI is going to vary based on your initial customers and the type of customers. What is a range for something like that, Dr. Raker? If you're out looking for your first customer, what kind of customer would you target?
Okay. So depending on the things you learn and the order that you learn them in, I teach people that probably step 1 is getting your DOT exam certification. That's probably number 1 across the board. Everybody needs to know how to do that. From that point on, usually the quick and simple is to do drug testing next, maybe alcohol testing next. And once you've got those 3 things under your belt, automatically you can do a 4th thing called running a consortium, where they have to pay you to be in the consortium for the random drug and alcohol testing pool. So those four kind of tie together. And then it depends on whether you go into maybe hearing or spirometry or fit testing. It all depends on what's around you. But I can tell you this, the very first company that hired me to do hearing testing had 300 people. So I did not buy the equipment or get really certified until I had a signed contract from that company that I was going to do their hearing testing. That way I knew for a fact when I spent the money to get trained and certified and get my equipment, it was going to be paid in 60 days. Their contract paid for my equipment, my training, and I even had money left over from that contract. So from that standpoint, that one service was bought and paid for with the first customer, and it was just gravy from there on out. Now, obviously, you might not run into the first company that has 300 people that need hearing testing. You may only have 10, but you will find that all these services are way more prevalent than anybody ever thought about. It's like in the woodwork that you never hear about. But once you start looking for it, and once you get out there and start talking with companies, it's out there. It's everywhere. I mean, every town has a fire department. The firemen need almost every service we do because their job is so hazardous. So if you get hooked up with, your city or your county for firefighters, you're going to be doing a lot of stuff. They need hearing testing. They need pulmonary function testing. They need respirator mask fit testing. They usually need heavy metal evaluations. They need, employment physicals for the new guys, annual physicals for the guys that have been there. They need everything. And there's always firefighters around. So it's not like there's any town that has nothing. Every town has something to offer and something to give.
Well, thank you, Dr. Raker. That's it will vary, of course, the type of customers you bring in initially and then down the road. And so, your ROI is going to vary a bit. However, the great thing is once you get locked in with a couple large accounts, they just keep giving, don't they, Dr. Raker? I think that's what you mentioned last time.
Yes, because most of these services are annual. Almost everything is annual. Probably DOT physicals. If a guy's healthy, he can get a 2-year certificate, but there's so many of them that are not perfectly healthy. They have to have every year, and sometimes even less, sometimes every 6 months, or even some 3 months if you find a major problem. So some of these things are repetitive within a year. Everything is annual. If you've got a company that needs hearing testing, it's every year annually, plus the new hires that come in to get a baseline. If you have to have respirator mask fits, it's every year. If you have to have pulmonary function tests, it's every year. So once you get with a company, unless you mess something up, they should be doing this every year. Oh, I've got some companies that I've been working with 18, 20 years. They just, because the government says they have to do it over and over and over. Oh, I think your mic went off, Dano.
Thanks. I was trying to clear my throat. But I love a business that keeps giving. And so it cuts down, once you've done your initial marketing, you found some customers and the like, then you can spend a lot more time earning the money and a lot less time actually trying to acquire new customers. Of course, you're always going to try and find more customers, but the amount of time you spend changes radically from finding your customers to servicing your customers. And of course, it's the servicing the customers where we make the money. And that's what's important.
Once you go on that growth spurt and you gain a lot of business, there's going to be a point where either you have to hire more people, expand your building, or stop marketing because you kind of max out on the amount of time and energy that you can devote to this. I kind of hit a point when I was right before COVID where we were maxing out on all cylinders, and we were making about $400,000 a year in OccMed every year, and we were just kind of maxed out. I would have had to, get more people or more room to do more things. Then after COVID, a lot of companies slacked off and they slowed down a little bit, but now it's starting to pick back up. that whole layoff thing has now ran its course to where companies are starting to gear up. They just announced in our town in Texarkana, they're going to build an Amazon, one of those big Amazon distribution centers. They said, I can't remember how many jobs they said, but it's going to be a lot of jobs. There's going to be construction. It's going to take them a year or two to build this thing. That's massive for us because we're going to be servicing all these construction companies. And then once Amazon gets here, we're going to be servicing hopefully Amazon drivers and Amazon people. So every company that comes along just adds into what you can do.
Yeah, and to add to that, Dr. Raker, a lot of these same industries that you would target for the services that you're talking about, DOT physical exams, drug testing, all of that, it's the same industries that are going to be the ones that you would target for doing, especially like a new manufacturing plant like that. Those are the ones you would want to target for doing like the job site analyses, the pre-employment, post-offer exams. Some of them are going to fall under that, like fit for duty exams or annual physicals, as well as like any injured employees, like those return to work exams. So
exactly. And like you said, like I had a company approach me that said, we have, one shop out of all our buildings. We have one shop. It seems like that's where everybody gets hurt at. That's our problem child. And they said, you've got to come out there and do some sort of a job site assessment and then try and figure out how do we stop this from happening. So that's on my agenda over the next month to get out there and get that looked at and see if I can help them with this. Dr. Woods was asking, do you keep different masks on hands for doing all these different respiratory mask fittings? No, literally there are hundreds, if not thousands of different masks. So what happens is whenever a company is hiring people or want you to do mask fittings, they will typically give you a small, medium, and large of the type of mask that they have and use for their work supply, to where they just give you one to hold in your building. So every time you got to do mask fittings, you'll have a small, medium, and large. Otherwise, you could try and go out and buy masks, but literally there's hundreds, if not thousands. You would have a big supply room and it'd cost you thousands and thousands of dollars. So you're not going to go out and buy masks. They're going to give them to you. We have a lot of travel nurses come through that have to be cleared, and they ship a whatever kind of like N95 mask they're going to wear at the hospital where the nurse is going. They just ship us one. We fit test with that N95, and then she's good to go. And when she gets there, that's what she'll be wearing when she gets there. So every company should give you and let you hold on to, if they're going to have a lot of people, the mask types that they're going to be utilizing. You don't have to buy those.
Great. Dr. Raker, in the seminar, are you going to cover how to bill for these services? It's a cash business, right? And so are you going to provide some ideas around how much to charge for the various services?
Yes, and that's integral. I can tell you the nice thing about this is it's all cash. The harder thing is because it's not standardized like insurance billing. I could tell somebody, people ask me all the time, what do you charge? I live in Texarkana, Arkansas, which seems to be about the cheapest place in the planet to live, because everybody that I talk to in other parts of the country charge way more than we do here. But I'm affected by the other medical clinics in the local market. It's kind of like gasoline. Gasoline varies from city to city and state to state. Within your city, you kind of know where the convenient place to go and what the prices are. And usually the ones sitting up by the interstate are the high priced ones. And when you get away from the interstate, it's lower priced. Everybody that's local knows that, and we know where to go and where to get gas. So when you start off with OccMed, the simple secret is, if you want to know how much to charge for fit testing, you're going to Google, where can I get fit tested? And when it comes up, whoever is in your area, you're going to call them and say, how much, if I need fit tested, how much do you charge? And they're going to tell you. And you're simply going to write down the names of the different clinics, the names of or how much they charge. You're going to build like a little grid, and you're going to put services and charges and the clinic names. When you get done, you have the perfect marketing sheet. Because when you walk into a company to talk to them, they say, we already have somebody. And we go, well, who are you using? And they say, whatever, Healthcare Express. You say, well, right here's the prices of Healthcare Express and everybody else in town. And you can see my prices right here are lower than everybody else's in town. And it's the perfect marketing sheet. I actually show them, why not? They know what they're paying and they need to see my prices in comparison. It turns into your best marketing piece to have all your prices and all your competitors laid out right in front of you. So that's how you do it. You call around, you get prices, you make a grid, an Excel spreadsheet, and you actually use that to set your prices and to show everybody else that you have set your prices lower than everybody. So it's pretty easy to talk them into, who wants to pay $6 a gallon for gas when I'm selling it for $3 a gallon. So when you walk in and you show them, my physicals are cheaper, my drug tests are cheaper, my alcohol tests are cheaper, my consortium fees cheaper, they have no choice but to say, well, let's talk about this because you're going to offer me a lot better deal.
So one of the interesting things you're talking about there, Dr. Raker, is that you are going to teach them and empower them to have a portfolio of solutions. So you become a one-stop shop. Now, are these other competitors, are most of them one-stop shops as well, or do they specialize?
That's the thing about this market. A lot of them are, you will have, because you don't have to be, certified, or there's a few certification that can be gotten by lay people. One of your competitors may be the guy down the street that got certified to do drug testing. So he opened up a drug testing business and that's all he does is drug testing. He's your competitor. Now, if you walk into a company and say, well, not only can I do your drug test, but I can do your DOT exams, your hearing testing, your spirometry, I can do all these things. They don't want to contract with 5 different vendors. They want a one-stop shop. If you notice in any small town where Walmart came in, all the individual mom and pop specialty stores died. When Walmart came in and offered anything that you wanted a good price, everybody quit driving around town to 10 different specialty stores. It was a waste of time. It was inefficient. If you can go to one place and get what you need at a good price, why would you not? And that's exactly what Walmart did, and what society has been led to is you want to go where it's fast, convenient, easy at a good price, and get in and get out and get done. That is the secret. If you become Walmart for occupational medicine, they will literally beat a path to your doorway to get services done.
Wow. So, so immediately you have a competitive edge. I think it was Dr. Woods was saying he has all the certifications except for 2 of them. Hearing, I think I've lost it, but you add those 2 to your portfolio, and now who's out there competing with you. As Dr. Raker said, my background is all business. The medical stuff is all new to me, and I'm learning as fast as I can. As Erik can attest, he laughs at me all the time when we talk about medical stuff. But my background is business, and that Walmart model that Dr. Raker described is you. You can be that. And the beauty in Walmart is not everything in Walmart is the lowest price. However, it's the convenience, it's the one stop, and then of course it comes down to your service. How effective is your customer service, which is also critical. But that's what your livelihood has been. So I have total confidence that your customer service will be exceptional. So yeah, what a great business model to be able to come in and offer all those services and be able to do them fast, efficient, cost effective. Yeah, who's going to say no to that? That's incredible.
Yeah, it's not really hard. These companies already have to spend this money. It's already budgeted. You're not, when you talk to a patient, they haven't budgeted really for their health care. Patients must make a conscious decision of, can I afford this? Can I come up with the money? Do I want to do this? This is not the case with occupational medicine. The government has already told these companies, you must do this, or we're going to fine you and shut you down. So the companies have already budgeted money. They've already been to this rodeo before, unless they're a startup company. So really, all you have to do is convince them, come shop with me because I'm convenient, I've got good prices, versus wasting your time trying to go talk to 5 different competitive people doing 5 different things and try and coordinate all that? Or do you want to talk to one person that already can do everything at a good price? It's not really a hard sell. Probably the hardest part is just getting to the door to the person to talk to. But once that conversation starts, it's usually pretty easy.
That's great. And along the business side, I want to shift gears slightly. It's interesting as we're the middle of October, which means the end of the fiscal year is 2.5 months away. And I know my accountant always wants me to give him or her a heads up as soon as possible if I'm making any capital purchases. And right now is the best time to let them know if you're going to make capital purchases or any other types of purchases that maybe weren't on the radar when you met with them, whether you meet with them quarterly or annually. And the reason is because they want to prepare and maximize your tax savings. And it's interesting, I know with the JTECH equipment, it qualifies for 3 different tax categories and could literally, effectively, you pay 25% of the cost of the system after the ADA tax, after the Section 179 tax, and after the Section 41 tax deduction. You could literally save 75% off the price. And so especially at this time of year, going to the end of the year, you want to do that as soon as possible so your accountant can make sure and manage all of that correctly. Now, what I'm not familiar with is on some of the other certifications and some of the other services you'll offer, if there's tax incentives there, but that's where you want to go talk to your accountant now and not wait till later and say, hey, I'm going to go get these certificates. I need to buy this equipment. I need to buy some masks and some other equipment. How can we maximize my tax credits for all of this?
Yes, and we do know that there is, if someone has not filed it before, if they've at least worked 3 years and had a practice, there is a refund for doing research that they can go after. We have, some tax attorneys that can help a doctor go back, and it could be as small as $2,000 or $3,000 a year, but it goes for 3 years. So that's, maybe $6,000 or $9,000 that you could get back, and it may be quite a bit more. Mine was up around 10,000 a year for 3 years that I got a tax credit on, and that could go towards buying more equipment, doing your training, and getting geared up for OccMed.
Precisely. So just wanted to throw that out there for those of you who are saying, well, maybe I'll wait till next year. No, do it now. Now get the tax credits, get all those benefits. And yeah, Dr. Raker, we've had many doctors who that Section 41 research, they were able to maximize that. And as you mentioned, almost 10,000 a year for several years. So there's great opportunities out there for on that side of the business as well.
All right. I can't think of anything unless somebody throws out a question. I'm pretty good at the moment. Anybody have any questions about, what's coming up at this live event, how we can help you, or any questions now about the equipment, what it does, what we can help you understand about this whole process?
So the live seminar is November 15th, and that's a Friday, and 16th, just in the morning. We'll do the marketing. We'll wrap up around noon. And it begins at 8 o'clock on Friday and probably 8:30 on Saturday. And then, so that way you can enjoy your Friday night. But November 15th and 16th, Grapevine, Texas. So just right, it's literally 10 miles, less than 10 miles from the airport, from DFW. I think it's even closer than that, maybe 7 miles from DFW. So we have a link that you can go to sign up. And let me throw that in the chat. So that's where you can go sign up. And on there, you'll find the agenda. You'll find a little bit about the 3 of us who will be speaking. Our bios are up there. and of course the admission and information about the venue, how to get there, where it is. All of that's up there on this link. And so I'm really looking forward to this. And we do have a limited number of seats, and we are filling up really fast. So as I think Dr. Raker mentioned, a couple individuals at the beginning that he's been talking to who are signing up. I know Erik told me someone else signed up this morning that he's talking to, a couple others yesterday. So it is filling up, and we chose a room hoping that, we chose the right size of room, but once it's full, and there's not much we can do. So I wouldn't hesitate, jump on and go ahead and sign up.
And don't forget, Dano, tell them about the little giveaway that you were doing.
Oh yeah, we have a giveaway. Yeah, an incentive to show up. Erik, do you want to talk about that?
I'll let you talk about it.
Okay. So everyone who signs up, or I'm sorry, it's the first 15 who sign up. So we have a couple left. Will get an adjustment tool at no charge. Just signing up, and you do have to show up because we'll bring them there to hand them out. But yeah, I mean, if you're going to sign up and pay, you definitely want to show up. But yeah, we will give an adjustment tool to everyone who signs, to the first 15 who sign up. So that's about a $300 value.
And I think, Dana, we also were talking about for anybody who shows up, and ends up purchasing our equipment, that we would include our manufacturer device certification training. So that certification training is getting certified in performing, computerized range of motion testing, muscle testing, static strength, whatever it is. And you don't need to be a licensed healthcare professional to obtain that certification from us. And of course, with it being a lot of times staff members that are actually doing a lot of these services, including post offers, it's good with any kind of these cases, med legal cases, OccMed cases, just have that certification in your back pocket, both for the doctor, but also the staff member that's performing those exams. So usually that's cost is around, I think it's around $995 with the exam and certification fees. So that's another promotion that we're going to be offering as well.
Yeah. So
that's huge. That's huge.
Yeah, that's a big deal. Thanks, Erik. And everyone gets that shows up. So
excellent. Well, I think we've got our hour filled. Hopefully we've answered enough questions, and hopefully we'll see some people in Dallas at the live event.
Yeah. Hands-on training. If you have equipment, you're welcome to bring it, and we'll show you how to use it. Otherwise, we will have equipment there, lots of equipment. So you'll get the hands-on, get to touch everything. This is going to be fun. I'm looking forward to it.
I am too.
Absolutely.
Well, thank you, Dr. Raker. Thank you, Erik. And we'll see you in Dallas.
All right. Thanks, everyone.